Now, this is a question that has preoccupied some scientists and researchers in Europe. Why are the majority of COVID-19 patients non-smokers? Now, Greek cardiologist and tobacco harm specialist, in fact, Dr. Konstant-inos Farsalinos, has investigated data coming from Chinese hospitals, and what he found was actually quite surprising. He joins us now via our Zoom line for more on this story. Dr. Farsalinos, thanks very much for your time. This is a question that sort of goes against what we understand about smoking and what we understand about the coronavirus, because the virus itself, we know, attacks the respiratory system. That same system is compromised by smoking. So surely smoking is harmful when it comes to COVID-19.
Exactly. This is what we could call a paradox, because we know that smoking increases the risk for respiratory infections, both for susceptibility and for severity. But when we started looking at data from Chinese studies, from publications of case series in China, we saw that, and you know, China is a characteristic case. There are so many smokers in China. Almost half of men in China smoke. And what we saw was a very low prevalence of smoking among hospitalized patients. So I have published right now 3 studies analyzing up to 12,000 patients. Not only in China, but also in the US and in Korea. And what we see is a very low, much lower than expected prevalence of smoking among hospitalized COVID-19 patients.
Yeah, and I just want to actually just remind our viewers of that. So 26% of the Chinese population, you're saying half of all Chinese men are in fact smokers, but only 6.5% of COVID-19 hospital admissions in China were in fact smokers.
Yes, exactly. And we've seen similar things in the US too. There are also a couple of studies which are showing that if you are a smoker, you are less likely to be hospitalized compared to non-smokers. But I want to clarify something. We cannot in medicine use smoking as a protective factor for anything. You know, smoking is a very harmful habit, and there is no reason, and it's not practical to use a product, even if it is protective for COVID. It is so harmful for so many other things that it cannot be used, it cannot be recommended as a protective factor. So what we're looking at is the effect of nicotine, because one of the components of tobacco cigarette smoke is nicotine, and nicotine, as you know, is available in pharmaceutical products, in medications. So it can be even used therapeutically if we find an effect.
So you're saying you're not touting smoking as a protective or preventative measure against COVID-19, but certainly there are elements of smoking, like you say, nicotine, that may well give us some answers.
Yes, you're right. You cannot use and you cannot recommend neither to initiate nor to continue to smoke for smokers. We need to convince them to quit, but I think at this time we should think of providing them with nicotine in a clean form, of course, not in a form of tobacco cigarettes.
Yeah. This is also an interesting discussion, because what's been a real bone of contention here in South Africa is the continued ban on the sale of cigarettes. Now, correct me if I'm wrong, South Africa is one of only 3 countries around the world in the midst of this pandemic that have actually prohibited the sale of cigarettes. So it's not something that many countries are actually stopping people from doing.
Exactly. It's one of the rare cases. I don't understand why. I don't think that the South African authorities can explain to us why. The reason is very simple. There is absolutely no data that banning smoking will have any benefit for COVID-19. I don't know if they've done it to reduce transmission because they think that smoking promotes transmission of the disease.
Yeah.
This is not happening. In fact, if you look at the smoking rates and the number of COVID cases per million in, for example, in the European Union and in the US, you will find a negative correlation between the smoking rates in countries and the number of cases. This means that the more the smoking prevalence in the population, the lower the number of COVID cases and the lower the number of deaths.
Wow.
So it's the exact opposite. We have no data that banning smoking has any benefit for the COVID-19 pandemic. And in fact, I can only think of one outcome from the ban. It is a party for the black market and the illicit trade.
So I want to just touch on that issue a bit more. Dr. Farsalinos, stay on the line. I want to just, if we are able to play this clip, this soundbite from Dr. Nkosazana Dlamini-Zuma and her take on why it is important to continue the ban on the sale of cigarettes. Let's just take a listen.
We had said we're consulting. In that consultation document, we had consulted about allowing cigarettes and related products, tobacco, and as you remember, even at the press conference itself, there was quite an opposition to that. And even in the public comments, there was quite a lot of opposition. More than 2,000 people opposed it. And of course, the government then took that into consideration, debated the matter, looked at it, and decided that we must continue as we are when it comes to cigarettes, tobacco products, and related, that we should not open up the sale of products. And the reason are health related. The reasons are health related. As you know, besides the effects of tobacco itself on the person's lungs, but also the way sometimes tobacco is shared does not allow for social distancing, but also actually encourages the spread of the virus, because when people share a cigarette, obviously if one of them has the virus, it will be shared amongst them. And then they'll go home and then spread it at home.
So, Dr. Farsalinos, if you could hear there, Dr. Nkosazana Dlamini-Zuma talking about the obvious, as you've also outlined it yourself, the obvious effects of smoking on the health of someone who smokes and on their respiratory system. But she also talks about social distancing and the fact that smokers, smoking is often a community activity. People do it in groups of people, that is also a danger as well. But you have your own theory on why government is still continuing the ban on the sale of cigarettes.
First of all, all these are pretty nice theories, and I fully understand the good intentions of the government, but these are totally unsubstantiated claims. They have zero proof for that, and I'm telling you one very simple thing that anyone can do. Take the list of the European Union countries and their official smoking rates, and then take the number of cases per million, so it's going to be case per population, and you will see that the exact opposite is happening. There is not a single example of a case where smoking or banning smoking reduces the transmission of the disease in the community. I think that these are just panic, knee-jerk reactions from the governments, which of course have the best of intentions, but it is very likely that they are doing more harm than good. It would have been ideal, and I'm fighting against smoking for so many years, and I have also personally fought against smoking, being a smoker myself and having quit 8.5 years ago. So unfortunately, we cannot solve the smoking problem by bans. We're just going to propagate the black market, and you know what? When you are banning smoking to, as a shock treatment to people who are addicted to smoking, well, you're going to make it worse. You're going to make more people trying to find illegal products and sharing products. You are creating a bigger problem. It cannot happen. Quitting smoking is something that can be done gradually. When you do such a thing, very sudden during a pandemic, you are creating a lot of social and psychological stress, and you are increasing the chance of looking at the illegal market for smokers to get their cigarettes.
Incredible story, this. Thanks very much for your insight, Dr. Konstant-inos Farsalinos, joining us there as we continue to unpack what really is quite a controversial story and the proposal that he's making, and he's backing it up with a lot of research. Go and check it out yourself. But he says countries with more smokers, in fact, have lower numbers of COVID-19 cases and lower numbers of COVID-19 deaths.